For the purpose of demonstration, we're using ungloved hands. After the patient has been cannulated with both the arterial and venous needle, and in this instance, we're just showing the venous needle, the Redsense alarm is going to be turned on, the on and off button once to the self-check, and a second time to actually turn the alarm unit on. You'll see a red glow in the end of the white connector to remind you that you need to insert a sensor. And this is a venous needle sensor. The button is pressed on the end of the white connector with your non-dominant hand, and the black stem on the sensor patch is inserted into the end. You'll see a brief red light. The alarm stops beeping and the green light turns solid. That indicates a connection has been made in the connector. Remove the paper covering the adhesive, and the sensor is placed as close to the needle insertion site, venous needle insertion site, as you can get it without riding up over the hub or the wings of the needle. Once this is in place, it can be taped over. Dressings can be applied without affecting the alarm. And then, it's important to remember to take the excess fiber optic extension, anchor it, secure it to the patient's skin to keep it from pulling. Because if you have tension on the connection between the sensor and the fiber optic extension, it can cause alarming. And that's it on the setup. To remove it, you first want to turn the alarm unit off. Hold the button in until the light goes off. Remove the tape. Remove the sensor. And the sensor is disposed of according to policy. Push the button in again and pull it out. You will also want to wipe the alarm unit itself and the fiber optic extension off with an alcohol-based disinfectant. Then, gently, loosely loop the fiber optic extension and hang it around the Redsense alarm in between treatments.